Animal intraocular lens model AnIOL 40D-713. Optical part with a diameter of 7 mm, optical power 40 diopters, overall diameter 13 mm. OptoVet company, made in Russia. Injection, implantation, training video. Intraocular lens for animals AnIOL 40D-713 is supplied in a plastic case. The lens has a monolithic closed circular haptic part consisting of 4 connected lobes. The optical part has a high-quality, crystal-clear lens with an optical power of 40 diopters. 4 holes are made around the optical part, and they are necessary for more controlled manipulation with the lens in the capsule bag. Due to the closed circular haptic part, the lens is characterized by extremely high stability in the capsule bag, and the optical part of the lens is always automatically centered in relation to the center of the pupil. The lens is intended for implantation after cataract surgery in dogs weighing more than 15 kilograms with large eyes and large domestic cats. Despite the fact that the lens is hydrophobic and does not lose its elasticity in the dry state, we recommended that the lens is wetted in saline for 1 to 2 minutes before implantation for greater softness and flexibility than packed in a cartridge. We also need to prepare the injection and cartridge for operation. First, they take out the silicone tip and carefully put it on the plunger of the injection. OK, injection is ready to use. Then we take out the cartridge and fit it well with viscoelastic solution. OK, cartridge is ready to use. After that, we pull the lens out of the solution using a micro tweezer. Important, the tweezers should be without teeth, so as not to scratch the optical part of the lens. We put the lens in the cartridge in the correct position, exactly as shown in the video. This is very important for the correct folding of the lens. We take a microsurgical spatula, press on the center of the lens, pressing the lens tightly to the bottom of the cartridge, and slowly bring together the wings of the cartridge while continuing to press the lens with the spatula. As we fold the lens, we fold the haptic elements of the lens on top of each other, as if folding the lens into a tube. All movements should be gentle and careful. After the lens is completely folded, we firmly connect the wings of the cartridge with our fingers. Then the cartridge is tightly closed, we should feel a faint click. After that, we insert the cartridge into the injector, push the cartridge as far forward as possible until it stops, and slightly insert the plunger of the injector with the tip into the cartridge, as shown in the video. Thus, the entire system, lens, cartridge and injector, is ready for implantation. Since this is a training video, we are implanting the lens in a small bath filled with saline solution. We gently pressed on the plunger of the injector, and we see how the viscoelastic begins to come out of the nozzle of the injector, and then the lens begins to move. It is very important to press the plunger of the injector slowly and smoothly, without stopping in one continuous movement. If the lens is folded correctly, the implantation does not require excessive effort. If the lens was folded correctly, it comes out of the nozzle of the injector in the form of a smooth tube and immediately begins to unfold. After 20–30 seconds, the lens fully unfolds and regains its shape. The implantation was successfully completed. Now you can see the overall appearance and dimensions of the lens immediately after implantation. 13 mm overall lens size and 7 mm optical part. Thanks for your attention. Our website www.optovet.com.